Hi, Dr. Yass here. And in this video, I am going to attempt in a very short period of time, because I have a tendency to talk for very long periods of time, I'm going to try to teach people in the simplest way how to determine whether your symptom is in the lumbar region, lower back region, or whether it is in the gluteal region. This is a critical issue, because as the Yass method promotes, the understanding of the symptoms helps to understand what tissue is in distress. So understanding what region that your pain exists in helps you be able to decipher what potential tissue may be creating that symptom. So very briefly, we have the lumbar region, which actually runs from the bottom of the rib cage to the top of the pelvic rim. And then from the top of the pelvic rim down, that creates the gluteal region. So in this first picture here, if we kind of bring this real close, you're going to see right here, and it's going to say Iliac Crest. Right here. That's the Iliac Crest. So we have the bottom of the rib cage, and then running down from the bottom of the rib cage to the Iliac Crest, that is the differentiation of the lumbar spine. Then below there, look how high that is. The iliac crest is all the way up here. That begins the gluteal region. You can see this coming down here and then going down below that. That is your gluteal region. So above the iliac crest is the lumbar region or lower back region. Below the iliac crest is the gluteal region. So depending on where your pain is going to determine what region your pain exists in, and that's going to then help to understand which particular tissues may be creating your symptoms. I have had thousands of patients who had pain somewhere in this region. They got an MRI that said that they had a herniated disc, stenosis, or a pinched nerve in the lumbar region, and were told that pain here could be created by the structural variation in the lumbar region. That is 100% impossible. Let me make this extremely clear. There is no structural variation in the lumbar region, pinched nerve, herniated disc, or stenosis that can create pain in the gluteal region. This area is actually innervated by the sacral spine, which sits below the lumbar spine. So let's be extremely clear. If this is your iliac crest, and you have pain below that, and someone is trying to tell you that some aspect of the lumbar spine, a herniated disc, stenosis, or pinched nerve, and by the way, it's not pinched nerve, it's nerve root. Nerve roots come out of the spine. So if you were told that you have a pinched nerve root, stenosis, or a herniated disc in the lumbar spine, it can never create a symptom in the gluteal region below the iliac crest. This is so critical for people to understand. And I'm putting this video out, and I'm trying to keep this short because it is one of the most significant ways of differentiating what tissue is creating your symptom in your back region, by knowing what region your symptom is being experienced in. As I said, if it's in the gluteal region, let's be very clear again. There is no herniated disc, stenosis, or pinched nerve root in the lumbar spine that can create symptoms in the gluteal region. So just another picture that might help that. If we're looking again, this is again the iliac crest. And the way to differentiate the iliac crest, by the way, is if I said to you, like that song used to say, you put your hands on your hips, you put your hands on out. So if we talk about putting your hands on your hips, people used to think that they would be putting their hands like this over here, and that was their hip. It turns out this is actually where your hip joint is. But when you're putting your hands on top of that area, that is the pelvic rim, also known as the iliac crest. There is your differentiation for the lumbar spine, right here, for the lumbar region, the bottom of the rib cage to the top of the iliac crest. And then below that is the pelvic region, the gluteal region. And so here is now on the back, here is your iliac crest, and here is the gluteal region, which holds all the muscles in the gluteal region, the gluteus medius, the piriformis, which is most apt to be creating pain in the gluteal region. And in the lumbar region, we have the quadratus lumborum and the psoas muscles. Those are the primary muscles that run through the lumbar or lower back region that can cause pain. All right? So just to recap one more time, you must know how to differentiate the lumbar region from the gluteal region, because the structural components of the spine in the lumbar region can never create pain in the gluteal region. So if you were to put your hands on your pelvic rim and imagine putting it like this, and you run your thumbs across and you feel that your pain is below your thumbs, that is pain in the gluteal region. There is no possible way that a herniated disc, stenosis, or pinched nerve root in the lumbar spine can create that symptom. You have to be looking in the gluteal region for this to be some sort of hip dysfunction, because as I showed in this picture, you can see that all the muscles that are in the gluteal region all end up attaching to the hip joint. So any symptom in the gluteal region is going to be associated with hip dysfunction. That has nothing to do with the spine. All right? And if it is in the lumbar region, it is most likely the result of a strained QL or strained psoas muscle. All right? So that's what this video is. It's short and sweet, but probably one of the most significant findings that could be established in determining the cause of your pain is establishing what area, what region is your pain in. Is it in the lumbar region, lower back region, or is it in the gluteal region? Hopefully, this is an important video and helps lots of people that see it be able to recognize where their symptoms are, and helps them to be able to recognize that in the highest probability, that diagnostic test finding really has nothing to do with the cause of their symptoms, that in most cases it is in fact muscular. So if you like this video, please give it a thumbs up. If you like the videos on my channel, please subscribe to the channel. I am putting out lots and lots of content, probably 2 to 3 videos, including YouTube live videos. And I want this information to be made available. So if you subscribe, you will receive notifications that I have put another video out, or I am on YouTube Live. The key and great things about the YouTube Live sessions are that it's an opportunity for people to contact me directly, and we can talk about the particular issues you may be having, so you can now move towards resolving your symptoms and be pain-free through the Yass method. If you want to get in touch with me directly, you can always contact me through my email address at drmitch@mitchellyass.com, DRMITCH @MITCHELLYASS.com. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional lifestyle. Let's get the right diagnosis, get the right treatment. Let's get you back to life you so justly deserve. Bye-bye for now.